Coronary artery disease is characterized by the narrowing of the blood vessels delivering oxygen to the heart due to atherosclerosis. Atherosclerosis is a complex inflammatory process that involves thickening of the artery walls due to plaque formation. Arteriosclerosis is the hardening of the arterial walls, generally due to calcification of the artery walls. Let's quickly review the stages of development of atherosclerosis. Before atherosclerosis develops, there's always injury to the inner lining of the arterial wall, the endothelium. This may be caused by smoking, high blood sugar, high blood lipids, aging, or hypertension. Stage 1. Fatty streak. After injury to the arterial walls occurs, the body attempts to repair the damage, and an inflammatory process begins. During the process, LDL cholesterol is brought in for the repair process. But when LDL becomes oxidized, a foam cell occurs. And this is formed, and this makes up the fatty streak. Stage 2. Fibrous plaque. Over time, the body forms a protective fibrous layer over the fatty streak. This fibrous plaque is made of smooth muscle cells and collagen, but also contains inflammatory mediators. Stage 3. Complicated lesion. The fibrous plaque will surround the lipoproteins over time, and if the lesion continues to expand, it can weaken and rupture the endothelial lining. This means that inflammatory mediators, foam cells, and lipoproteins may spill into the lumen of the artery, and the plaque may expand into the blood vessel. The body tries to plug the hole and create a clot to stop any bleeding and allow for the repair process. So now let's talk about the progression of atherosclerosis to a myocardial infarction. Remember, most MIs are not caused by a slow, gradual narrowing of the artery until it finally blocks off blood flow. As the plaque grows, the lumen of the artery actually widens. And keep in mind, the plaque must occupy about 50 to 70% of the artery before blood flow is compromised. If blood flow is compromised, patients generally experience chest pain when demand increases, such as during exercise. This is called angina. Most MIs result from plaque rupture because when the plaque ruptures, the clot, known as a thrombus, may occlude the artery and block blood flow to the heart tissue. Without oxygen, the myocardial cells die and heart function is compromised. A thromboembolus is the result of part of the clot from the ruptured plaque breaking off and traveling in the bloodstream. The clot ends up lodging in a smaller artery, blocking blood flow, and this causes ischemia and eventual cell death.